President Trump was also addressing what you might consider, well, the worst crisis inside the U.S., the national opioid epidemic today. Joining me now for more insight, my panel of medical experts, the Hills Treatment Center founder, Howard Samuels, and anesthesiologist and pain management specialist, Dr. John Dombrowski, who also is the CEO of the Washington Pain Center. Welcome to you both. Great to have you here. I want to start with something Tom Price, HHS, had to say about this. Dr. Howard, I'll go to you first. You're in the Hills Treatment Center. You know all about this opioid problem. He was asked, the head of HHS, hey, should this be designated a national emergency? We have some 142 Americans dying every day from overdose. I mean, this is an astonishing number of people, a real threat to America. Isn't this a national crisis?
Well, there's no question it's a national crisis. And once again, all we're hearing is talk. There's no plan, there's no proposals. And that's what's really scary here, is that I'm glad that they're bringing it to everyone's attention, but we who are on the front lines are dealing with death of our young people every day. I mean, I was at a hospital in LA just yesterday, and they are only getting 3 to 5 Medicare days inpatient only. I mean,
so people are in and out and not really getting the treatment they need. Dr. John, that's exactly what the head of HHS was saying, is what we need is more treatment, more money for treatment. Is throwing money at this the thing that's going to solve it? I mean, what does it take? Does the medical culture have to change in some way? Because let me tell you, if you are under the care of a physician, and just to digress for a moment, I was treated recently for breast cancer in 2016. I got all kinds of drugs. I mean, I was shocked at what the doctors were willing to give me.
You're exactly right. And I'd like to make some news here. Actually, the American Society of Anesthesiologists is attacking the problem, not with money, but with medical care. What we're trying to do is really educate. It's a team-based care between the physician, the surgeon, and the patient in terms of preoperative testing, in terms of intraoperative care and postoperative care.
What does that mean in English?
Okay, what that means is this, is that the anesthesiologist, we want to be the person that's in charge of your pain. So in other words, we're going to talk to you right beforehand. Here's some pain medications you're going to take that are not opiate-based. They have no addiction potentials. We can do certain injections or blocks or anesthetic agents to give you so you can have great postoperative care. And more importantly, we're going to educate the surgeon on how many medications to give you.
Dr. John, though, and let me go to Dr. Howard, though, for a second here, because it's interesting you say non-addictive, right? We have options out there that are non-addictive. Right. We thought that these opioids were non-addictive, Dr. Howard. I mean, that was the word out there, that nobody's going to get it. Everybody can use this because they're not addictive. How could we have been so very wrong? Dr. Howard.
Well, once again, it's the medical community that did not pick up the ball and did not educate the patient. Now, I must tell you, we're beyond that. I got people dying every day on the streets of L.A. from heroin overdoses, okay?
But that's not how they start,
That's the issue today.
They start with prescription drugs. That's exactly how this starts. And let me tell you, it's not necessarily people who are stealing it from mom and dad or even buying it from people who are using it. These are folks who a doctor somewhere sits down and writes a prescription for opioids, and what do you know, 30 days later, you're addicted. Dr. John.
That's correct. I mean, so you're exactly right. So we, from anesthesiologists and people in the pain medicine community, are starting to educate physicians as well as patients and surgeons on give little-based medications. And the medications that we are talking about are truly non-addictive. I think you might be a little misleading in terms of the opiates. They thought it was a panacea, and unfortunately it was the government, the federal government, that told us we must treat pain aggressively. If we don't, physicians will be penalized financially if we don't treat them aggressively.
Well, that's a good point. That's a good point, because there are a couple of things going on here, because doctors are getting evaluated. Their salaries are dependent on how popular they are with patients. So the more you write prescriptions, the better off you might be. There's all this incentive for the doctors to write these prescriptions. And for a long time, there were really few regulations about it. But I want to address one more thing, and to you, Dr. Howard, because you're really in the streets. You see what's going on firsthand here. Medicaid folks are getting a lot of these drugs. And it's because I believe Medicaid doesn't have the money to really treat people long term, so these drugs are a shortcut. And some of the numbers that I've seen, 25% of Medicaid members have filled an opioid prescription in the last 30 days. How tragic is it that our federal tax dollars are going to these folks in the worst kind of way with the worst kind of consequences? Dr. Howard.
Well, you know what, Jerry, I have to totally agree. And this is what's interesting, is that they throw opiates at the problem for their pain, yet they won't throw treatment that's acceptable for the detox and the recovery.
Right.
So
it's
all about treating the pain.
It's more expensive.
And
that's why we don't
not about
do
the treatment centers. But that's why we have to change this philosophy before more people die.
Dr. John, a quick last word, please.
Sure. So, I mean, he has a very good point, but how do these people get addicted? I mean, I'm very fortunate to run 2 methadone clinics, and half of them do not want to get there because of they were in the wrong basement at the wrong time. They're not here to get high. They're here to treat their pain, and we're trying to really educate, hopefully, the federal government to get to the right individual. That's an anesthesiologist who can practice appropriate pain medication and management and treatment.
Guys, thanks so much for coming on today. Big day in this opioid crisis and a real threat to Americans across the country. Thanks so much.